Hi, my name is Lisa Tonner, and I'm going to be teaching my students about multiple sclerosis. I think it's important for them to become familiar with various diseases such as multiple sclerosis in order to be a competent nurse. So students are going to explore the signs, symptoms, pathophysiology, treatment, diagnostics, and epidemiology of MS for this lesson. So the objectives that I have picked are students will list at least 2 different diagnostics used to help diagnose MS by the end of this lesson. Students will be able to recite at least 3 different signs and symptoms for MS by the end of this lesson. And students will list 2 different treatment options available for MS by the end of this lesson. And the last objective will be students will understand the pathophysiology of MS also by the end of this lesson. As for the content, the first thing I'm going to talk about, I'm going to go over the pathophysiology. This is going to be in a classroom setting with nursing students, probably age 20 and up. I'm planning on doing it in probably a PowerPoint, but the content, I'm going to start with the pathophysiology. We're going to go over the normal anatomy first of a neuron, with the nucleus, the dendrites, and the myelin sheath. It goes over the cell body and the synapses of a neuron. And then I'm going to go into the pathophysiology of MS. So I'm going to talk about MS. It's a diffuse and progressive CNS inflammatory autoimmune disorder that affects both the white and gray matter of the central nervous system. Autoreactive T and B cells and macrophages breach the blood-brain barrier of the brain and the spinal cord in association with upregulation of adhesion molecules and inflammatory cytokines. These cells recognize myelin autoantigens and produce myelin-specific antibodies, triggering inflammatory demyelination. So this causes a loss of oligodendrocytes, and the plaque of MS is characterized by loss of the myelin sheath, relative preservations of axons, and glial star formation. Activated macrophages and microglial cells are both found in active MS lesions. The loss of the myelin disrupts the nerve conduction, leading to presentation of symptoms associated with MS. There is at least partial repair of myelin during the relapse of symptoms. Death of the neurons and brain atrophy is the most progressive form of this disease. Currently, MS is believed to affect nearly 1 million adults over the age of 18 in the US. While MS is not contagious or directly inherited, epidemiologists have identified factors in the distribution of MS around the world that may eventually help determine the causes of the disease. MS is not reportable, which means there's no easy way to actually count how many are diagnosed with this disease. Most people are diagnosed between the ages of 20 and 50. In general, MS is the most common in areas farthest from the equator. MS is at least 2 to 3 times more common in women than in men, and suggesting hormones may also play a significant role in determining the susceptibility in MS. Genetic factors are thought to play a significant role in determining who develops MS. Research has also shown that MS occurs in most ethnic groups, including African Americans, Asians, and Hispanics and Latinos, but is mostly common among Caucasians in the Northern European ancestry. I'm also going to talk about diagnostics. So there's no single test available to diagnose or rule out MS. And many conditions can mimic MS clinically and radiologically, particularly early in the disease process. A clinical examination in combination with the MRI to demonstrate MS lesions in time and space is the current criteria being used to diagnose MS. The MRI is the most sensitive and available method of detecting and monitoring demyelinated plaques and quantifying macrophage infiltration and abnormal iron deposition. Treatment. The treatment goal in MS is to prevent exacerbations, to decrease MRI lesion burden, and to control the symptoms. Disease-modifying drugs are initiated with diagnosis and include corticosteroids, immunosuppressants, and immune system modulators, which suppress circulating immune cells and inhibit passing the blood-brain barrier, while decreasing the immune response. Continuous monitoring is important because of the increased risk for infections when taking these drugs. Stem cell therapy is currently under investigation for MS. Symptom management is essential to improve quality of life. Supportive and rehabilitative management is directed towards preventing complications of immobility. And lastly, I'm going to talk about outcomes for MS, for those who have MS. So although there's currently no cure for MS, the life expectancy is actually the same life expectancy as general population. On average, most people with MS live about 7 years less than the general population. MS generally affects quality of life more than longevity. People with MS must deal with many difficult symptoms that will affect their lifestyle, but with symptom management, medications, rehabilitation, and support, the prognosis can be promising. And then after the content, part of my lesson plan, I wanted to get the class together to do a presentation in groups. So they'll be put in groups of 4, and they'll be making a poster about MS, and they're gonna present it to me one by one, each group. There'll be probably about 5 groups, depending on the size of the class. So they're gonna teach me about MS, and we're gonna see what was retained and what they learned, and this will also help reinforce their learning about MS. Another thing I wanted to do was an individual quiz after the presentation. There'll be 4 questions. So the questions that I'm going to ask is, 1 being, what is the lipid that surrounds and insulates a neuron called? I'm going to want them to know in MS what diagnostics are used to help diagnose this disease, and to list 3 signs and symptoms. And a true and false question. MS is a diffuse and progressive CNS inflammatory autoimmune disease that affects white and gray matter. And they should know the answers to these questions just by listening to me and by doing their class activity. So, and then after all of these activities are done and the quizzes are administered, the closing part, I'm going to assign them homework to find an article on MS and with the handwritten conclusions to bring and present for the next lecture for the next day, kind of to help reinforce their learning. And I think after that, that's pretty much it. All right, thanks.